All right, welcome to another episode of Topic Discuss. We're live, and so if you're watching us live, please make some comments and enjoy. And I'll be watching comments. I'm bringing in our special guest star, Roger Plotho, and we're going to talk about healthcare policy. So buckle up, buttercups. And as I bring him in, Roger, hi.
How are you?
I'm really good. How are you?
I'm well. Had a good busy day.
Good. I did too, and I'm sorry I'm running a little bit late here.
No, all's well.
So we had a long discussion in our last episode on topic discussed, specifically related to a lot of different issues. And during that episode, it was Cocktails with Roger, and we discussed healthcare policy came in to the conversation. And I obviously, I have my history of work is in healthcare, but I didn't realize, Roger, your experience with Obamacare. I remember when Obamacare was coming into play. I was working in healthcare, and I grew up very much in a Republican setting where I kind of just felt all this information around me with my family, my parents, that Obamacare is going to be bad for healthcare. But I watched the evolution of that as someone in healthcare, realizing that what all the boogeymen were saying were not true about it. So I think you and I have our own kind of experiences with this, and I haven't met many people who have taken the time to actually read the Obamacare or the Affordable Care Act. And in our last episode, you mentioned that you had, and so and we have live guests, Roger. So we might get some questions while we're doing our show tonight. But I'd like to just have you share and have you take us down the rabbit hole. But really, I'd love to hear you talk about your experience when Obamacare was first kind of coming on the scene, and you even met with Mike Lovett and other healthcare policy leaders. So we'll turn the time to you.
Well, I'll give you some reasons why I did this. And part of the reason that I took the time to read the entire ACA was that I don't have much of a life otherwise, and so I had the spare time. But I was an employer for a long time, and for a good share of that time, our company was self-insured, and so I had to learn enough about health insurance to at least be able to be conversant, but also to understand its impact on our business, its impact on our employees, its impact on our ability to be competitive in the marketplace for labor, all of that. And so obviously we had a third party administrator who helped us put the program to get together and to administer it. But I had to kind of get into the guts of healthcare more than I wanted to. I mean, it's not much fun, and it's really complicated. But I really had no choice. And so that was the background for why when the ACA was going through the legislation, and because I'm a bit of a policy wonk anyway, I pulled it up and I read it, and I really don't know very many people who have done that, and so I'll skip back to what my reaction was to the initial legislation, but in later on, as the newspaper business in which I was involved up until a couple of years ago began to really suffer revenue shortfalls, and and went on the decline that it's continuing on, we we all began looking for alternative sources of revenue. And one of the places I went was we I created a series of policy conferences based in Idaho and Wyoming, one of which was the Idaho Healthcare Summit, which went on for 5 years and became a bit of a thing. Sadly, with COVID, it hasn't been repeated, and I hope it comes back. I won't be doing it, but I hope it comes back. But the first one we did, we brought in Kathleen Sebelius, who had been HHS secretary under Obama and had essentially fallen on her sword when the rollout of Obamacare went through a rough patch. And she
Yeah.
sort of took the blame and was as happens in politics, was booted out. But we also brought in Mike Leavitt, who had also been HHS secretary, and of course, each of them had been governors, and so they had the experience of being a governor. And it's interesting, once you've been a governor, regardless of what else you've done in your life, they want you to call them governor because that's the highlight of their political career, I think, unless you become president. So Mike Leavitt and Kathleen Sebelius and I shared a stage for a good share of a morning, and I got to meet to talk with them at length individually. Had dinner with Governor Sebelius, and then we did another 4 of those in which we brought in some previous surgeons general and a lot of private and public healthcare experts over those years. And so I got to really dive very deeply into healthcare. So back to the original ACA, what really struck me about it as I went through it was it was a lot of pages. It was, I don't know, 800 pages or something. It was, as legislation is, but it was very, very modest in what it ultimately was attempting to do. And really, you can bring it down to, so the individual mandate was by far the most controversial piece, and there was a great effort to try to make it pass constitutional muster in the way it was written. And clearly this was the major issue that they were concerned about, and rightly so, as it turned out. So there was the mandate. There was the creation of the process of buying healthcare through these state websites. And it was all and there was the pre-existing condition issue where that would be taken off the table. And those were really, in my view, and there may have been other things that were more technical that were really important, but from my perspective, those were the really key pieces of it. And if you think about it, the individual mandate was created to widen the pool, to bring everybody in, because really without that, it doesn't function as intended. And so there are serious limitations if people can opt out, particularly young people. And those are the ones who tend to opt out, is they will opt out because they're going to live forever. When you're 22, you're going to live forever. By the way, this is a classic Manhattan bourbon, a little sweet vermouth, and a maraschino cherry, and some Angostura bitters, if anyone's curious. So, and then you end up getting it weighted toward old people like me who are going to strongly utilize the healthcare system. But what you need is that broad balance of young people who are going to be less likely to utilize the system, and older people who are more likely, because that's how you create a full marketplace where you're sharing the load and you're sharing the upfront expense. That was what struck me about the ACA, was it was really modest, and one of the biggest pieces was taken away. Um, and so
Yeah,
and
that
so
should have made it
now
work.
and now and so now, but even with that, even after the mandate was taken away, there are 31 million people who are using the ACA to get insurance, basic
Hmm.
insurance. And so it keeps growing. It's not like it's just disappeared. It keeps growing, which is why when Donald Trump was president and he kept telling us how terrible Obamacare was, but he knew that it was so popular that he couldn't just wipe it off the map, and so he kept saying, "I'm going to, yeah, I have a plan. I have a plan. It's coming soon," and it kept coming soon, and it never came, because. And one of the classic moments in the Trump presidency when he said, "It turns out it's quite complicated."
I know. Oh, thank you, Trump, for your
Yeah,
wisdom.
as it
Yeah,
happens, it's kind of complicated,
it
and
is. Yeah.
really it is. So that's kind of my takeaway on the ACA, and it was, and even then, how modest it really was it took. He had a window. Obama had a window, a 2-year window, where he had both houses, the Senate and the Congress, the House of Representatives, to get it through, and because he knew midterm he was probably going to lose one or the other or both, which is what happens. And so a lot of people were, and then you had the former governor of Alaska who's talking about death panels and such things, which, you know, all these boogeymen were created that just weren't part. And this is why I wanted to go in and read it, because none of that was part of the legislation. It wasn't even close, and ultimately, it was quite modest.
You know what was this is really interesting. Thank you, and thank you for our viewers and our audience. Some of my viewers are blind, and I care about them, and I've gotten feedback that I need to be sensitive and refer to you all as my friends because you're not all watching. Some are just listening. So to our friends that have joined us and that are watching us live, thank you for joining us. One of the things that I remember about this when and again, with my background in healthcare and healthcare administration and healthcare policy, I, um, I can recall being with a family member. It was actually my brother-in-law. And in fact, I think that my sister is watching right now, and it's her husband, Ralph. And what I can remember kind of debating with him about was because I really did have, I mean, I was a Republican delegate. I really did not, I kind of had this indoctrination about, I don't know what, really, looking back on it. I just knew this is a Democrat. We don't need the federal government getting involved. And so we kind of had this debate, and he said, well, all I know is I I now don't have to worry about my kids being off my health insurance until they're 27. And I just thought, and what I tried to argue with him about was, oh, well, we do that at my company. And he wisely said, but your company only insures this many people, right? And that was kind of eye-opening for me because I realized, or I hadn't really taken into consideration the variability in insurance companies across the country. Some insurance companies might extend benefits to their children until they're 27, but that was rare at the time, and it wasn't universal. Furthermore, pre-existing conditions were not. Or is it? Well, my sister's she's watching and correcting me, saying 26, but I was pretty defensive, right? And I can remember reading the healthcare policy, Obamacare myself. And I remember reading it, looking for the boogeymen, right? I was looking for those death panels. I was looking for where all these things are that are wrong. I even remember when it was first rolled out, which was Obama's first term, I was excited. I'm kind of confessing all of my sins here. I was excited that the website crashed, the rollout sucked. I was like, oh look, it's not working. But here's what happened, right? What then I began to realize as my job evolved, and I had some promotions and began working with some of our more senior strategic leaders. We were invited by Barack Obama. My company and leaders in my company were invited to the White House and to participate in developing what Obamacare would look like, because there was recognition that our healthcare system had figured out ways to maintain lower cost and increase outcome. And what was really, and I began like learning about what really is happening nationally. I knew nothing about what was happening in healthcare outside of Utah. So I thought I'm some kind of healthcare expert, but my eyes were really opened when we're sitting at the table with other states who, we're talking about like, here's what here's what we're experiencing in our state, and we explain what's happening in our state, and and that's when I realized how different each of the states actually are. And just because something works in the way that we're managing care in Utah, it's not going to be the same elsewhere. So I'm actually going to read a comment from a viewer. I've been walking pre-existing conditions since I was quite young. I'm so grateful for the laws passed to remove that roadblock when changing insurance companies' proof of prior insurance. Thank you for that comment. And that's exactly what Obamacare did for us. Is it ensured that we had the same basic insurance requirements everywhere. And it's particularly where I'm at in St. George, that becomes even more important, or other parts of the country where you're living on a border, where we're taking care of patients that are in Nevada or Arizona, or even Colorado in the Four Corners. We happen to be this referral hub. And so if we have some patients with insurance, some patients that don't have insurance, they use the emergency room for their primary care. So I start to kind of realize that my own politics had created a bias. And here's what I want to say that maybe has created a new bias, because I can remember in Obama's second term. So we had really worked hand in hand with Obamacare to figure out how to make it work, how to make sure that we had better access to people, that access was inclusive, right, of those Native American nations that were not getting access to healthcare, or other underrepresented and underserved communities, and part of this plan was something called an accountable care organization. And in accountable care organizations, you share risk with the hospital, with the physician providers, and then there's some shared accountability with us as the consumer. But that would require the federal government, as part of Medicare and part of Obamacare, to set aside in the federal budget dollars, and those dollars would be distributed to healthcare organizations or accountable care organizations that met these criteria: higher quality, lower cost, and better access. So we planned for that, and I was part of that. We put a lot of effort. We created our budgets around that, and I will not forget having an emergency meeting in the boardroom. And we were told in this meeting that our budgets were we were kind of in trouble because the government pulled the plug on the accountable care organization concept. So I was like, what? So I looked back to see what happened with the legislature, and it was Marco Rubio. It was Marco Rubio and other Republicans, out of just vitriol and anger, to get rid of Obamacare, not because it was the right thing to do, not because they had an alternative plan, but just to be, what I call the new Newt Gingrich or Trey Gowdy Republican, kind of, we don't have a plan, but we're just going to fight against whatever plan the opposite side comes up with. And that left us in really big trouble. And so what's the parts of Obamacare that didn't end up working, that really would have worked or been better for us, were torn apart by the Republicans, the very party that I thought had this figured out. So anyway, that's kind of, and I think it's created a new bias for me, which we'll get into in a minute. Go ahead, Roger.
Well, I was just going to say, so, we all remember Mitch McConnell famously saying that his whole purpose after Obama was elected to see that he didn't get a second term. And that became the gospel of the party at the time was, I don't care what's going on. All we're here to do is to defeat Obama at every turn. Well, I am sure that there are Democrats who when Trump was elected were saying the same thing, whatever it takes, right? And so that in and of itself is counterproductive to the greater good. We know that intuitively. The people who say it know that, but that's kind of where we have come to. And I just, speaking of biases, I want to reveal my two fundamental biases on this issue. The first is the idea that in a contemporary civil society, in a modern society like ours, like we want to be, healthcare is a right, not a privilege. I believe that. It ought to be a right, not a privilege. And in all of the other post-industrial countries, that is their approach. We're the only one that doesn't take that approach. Secondly, our healthcare system, which has never really been a system and is certainly not to this day, is badly broken. And this is the one thing where Mike Levitt and Kathleen Sebelius absolutely agreed. When they started talking, and they had a room full of physicians and healthcare experts, the first thing that Mike Levitt said was, you all need to know that the system that you have come up under, that you're working in today, is bad and cannot survive. It's going to change, and so you need to get on board and help us figure out ways to fix it, or it's going to get fixed despite you, but it's going to change. And he was very, and I think it took a lot of people, because this is Idaho. And so, this is the reddest state probably right now in our country, and he was one of us, saying to us, folks, it's broken, it's not sustainable.
So I just that's interesting because I actually was at a meeting with Mike Levitt last year regarding this concept in terms of how do we move forward, because again, this was at the end of this was actually during the election between Biden and Trump. And Mike Levitt actually predicted in that meeting that Trump would lose, in fact, by big time, right? So he knew that would happen, just because of his political contacts, but that really created a conversation around, so what do we do going forward? And what was interesting that he mentioned is whether or not Republicans are going to get on board with understanding healthcare, there is a problem. It is broken, and we have to expand coverage. And let me talk about why that's important. Because when people don't have health insurance, when they don't have coverage, then they're less likely to use healthcare. So, and this is kind of a problem even with our new high deductible plans. I have a high deductible plan, so my deductible is really high, and if I save money in my HSA, then I'm not so worried. But if I don't save money in my HSA, or if I don't have very much in there, then I'm really going to be picky and choosy about, the healthcare that I'm going to receive. The problem that generates is that people don't get the healthcare for preventive things that they need to be doing, and then when they're really sick, they end up in the ICU, and then care becomes astronomically large at that point in time. What was interesting that I liked that he said was expanding Medicare could look like, for example, instead of Medicare starting for a 65-year-old, we start Medicare for a 55-year-old and make that an option. But you can see where that would be going. It would eventually mean 45-year-olds can access Medicare and so on. But I think, go ahead. Yeah, go ahead.
So there, that's the whole slippery slope argument that oftentimes is completely malicious, and it's a trope that we use to defeat something we don't like. I'll just tell you a quick story about what happened in Idaho. So in Idaho, there was a movement some years ago to expand Medicare to cover, because the same thing that happens everywhere was happening here. People who weren't insured were waiting until they were very, very sick, and then they would show up at the emergency room, and then they would be covered by the county, which would then pass along the cost to the state. And we had what was called, I'm not making this up, the Catastrophic Healthcare Fund. Well, anytime you're naming something catastrophic, there may be something wrong with the whole concept.
Right.
And so there was a push in the legislature to expand Medicare, and it failed. It didn't even come close. But a group put it on the ballot as a proposition, and it easily passed in red state Idaho. Everybody got it, that it's going to be less expensive and more humane.
Yeah.
Give people access to healthcare before they're dying. And even just looking at it from the most conservative political perspective, you're saving taxpayer money. It's less expensive. And so take away all the warm fuzzy stuff, all the tree hugger stuff. That really is what I think pushed it over the top. And so now in Idaho, we have expanded Medicare, and the legislature has made it more difficult to pass propositions.
Well, because they're Republicans, right?
Well, I mean, I'm
sorry.
They're not just, it's not Republicans. Republicans aren't the problem. It's crazy people, crazy Republicans. And we have, and that's the problem. It's Republican. There are a lot of great, thoughtful, conservative thinkers out there.
Right. But they get kicked out.
They get shouted down.
Yeah, no, I agree. If you don't worship Donald Trump, then you get kicked out if you're a conservative. When you were talking about that for Idaho, was that for Medicaid?
I'm sorry. Yes, I used Medicare. It's Medicaid. It was Medicaid.
Medicaid expansion.
Yeah.
And so Utah just did that too. And by the way, for our audience watching, Medicaid, part of Obamacare included additional funding for Medicaid from the federal government that can come to a state if the state will expand Medicaid. And conservative states would not do that throughout the Obama administration. And it was during Trump's administration that these red states put it on the ballot for the public to vote on. And in Utah and in Idaho, the public said, yep, we want to expand Medicaid and participate in Obamacare. We have one of our audience members saying an example of getting kicked out is Liz Cheney. But I would say the same thing about Mitt Romney. But here's the other thing too that worries me about politics and healthcare. So I go back to the example where we as a healthcare organization were prepared to enter into the world of an accountable care organization or shared accountability organization with public policy, private insurance, and the patient and providers. And again, a party, the crazies in whatever party pulled the plug. And it really was very disruptive to healthcare. And that ends up being disruptive to the patients. And so, what worries me about government involvement and public policy with healthcare is that at any moment in time, you could elect a bunch of crazies. I mean, how much time was spent with Republicans in the first 2 years of Donald Trump's time in office to just undo Obamacare? I mean, all they were saying is just get rid of it without a plan in place. And yet it is so important to our system that as healthcare providers, we were not consulted by one Republican. Um, so how do we avoid a political badminton from wreaking havoc? Like if we did expand Medicare, which means lowering the age for older people to get access, and Medicaid for those who are disabled or can't afford it, how do we ensure that or protect that from kind of the crazies in this back and forth with political parties?
We don't, and I don't care because what's the alternative? The truth is that we don't, we're afraid of the government for all the various reasons, some of which are absolutely reasonable. But there are issues and there are areas in which we can't fix it without government intervention in some way. Here's an example of an area where we don't want the private enterprise participating, and that's in prisons. We
Right.
now have private companies providing prisons for our country, and so here's what happens. You have a private company that is publicly traded on Wall Street, and the CEO of that company and the board of that company has basically one objective, and that is to maximize profit, to improve shareholder value, right? Well, and they are running prisons, and so what they are incentivized to not to deal with recidivism. In fact, they want to increase recidivism. They don't want people to be let go. They don't want them to learn to survive in outside the prison world. And so, and I believe you can make similar arguments for healthcare. There are areas in which the free market, however you want to define that, just doesn't function well when it comes to healthcare, particularly if you believe, as I do, that healthcare is a right and not a privilege. And so, but then you have to deal with, if you look at all of the various plans that are available in Canada and the UK and France and Italy and Japan and wherever, they're none of them is the same. They each take a different approach. There is and none of them is perfect, because you can't ever get there. But you can't let the perfect be the enemy of the good, or the better. And in this case, the better is going to require a deeper engagement of the government in some fashion. We have 61 million Americans on Medicare. We have 75 million Americans on Medicaid. We're already there.
Yeah.
We're already doing it. When you add the number that are getting insurance through Obamacare, more than half of our country is already there. And so what are we afraid of? And as people, boomers, start going on to Medicare, that number is only going to get bigger and bigger and bigger. And so we're afraid of something that we're already engaged in.
So we have a comment from a friend. Our payer segment is afraid to lose revenue, and they use the Republican Party to push their agenda. Yes,
of course,
absolutely.
Yeah, I mean, so that's where the whole insurance lobby comes in, and they are powerful and they have big dollars, What's never going to happen in our country is we're going to go to the insurance companies and say, okay, you're out. We're now, tomorrow we're single payer. No, that's never going to happen. Nobody thinks that's going to happen,
Right.
ever. So, but there are models in place that Switzerland is an example of where they are utilizing insurance companies, but they regulate it very strictly. And so in Switzerland you have the share of GDP that is spent on healthcare is a little higher than some of the other places like the UK, but it's still significantly less than ours, and their outcomes are second only really to Japan. Now there are all sorts of reasons that you can go into, the demographics and such, and the behaviors and the lifestyles and that sort of thing. But my point really is there are models out there that aren't single payer, that aren't Medicaid or Medicare for all, that aren't, just, the VA. I mean, VA is a single payer system basically in our country. That's never going to happen on a wide scale here. And so let's just take that off the table. Let's not debate that. Let's get into, okay, how do we, and maybe it also has to be incremental, but but the only thing that we can't do is nothing.
So let's bring up some ideas. So one of them is, because we are basically almost like 50 small countries, you could compare Utah or Idaho with Denmark. So if we're 50 small countries, do we manage the healthcare insurance through, or kind of this this regulated model just through states and not federally? What are your thoughts?
Well, I think that an example of how that might work is Canada, where the provinces are responsible for the system, and so there is a federal regulatory oversight, but it's left to the provinces to handle. And so if you go from Alberta to British Columbia, there are some modest differences in how it functions. I don't think you're ever going to get away from the fact that we're 50 states.
Right.
And in many ways, it's one of our strengths because I do think that creates what I used to call in the business world some creative tension.
Yes.
That isn't necessarily a bad thing. So yes, I think that this is going to be ultimately a state by state situation, but at some point there is a role for the federal government to say, look, there is a standard, there's a basic standard that we're all going to meet here, and just because you're in Mississippi doesn't mean that you're going to be treated less humanely than if you're in Massachusetts.
Which in reality is what happens now, right? So Medicare is for our baby boomers. It's for people over 65. And that is standard across all 50 states. There's some administration that happens at the state level, but the funding is federal. So you do get consistency.
There are contractors who do the administration state by state in many cases, but the differences are very modest, and overall the regulatory process keeps it even.
But in Medicaid is managed entirely by the state. Medicaid
Correct.
is actually where you need to have consistency, because if you have a state that doesn't fund Medicaid and doesn't care about healthcare, like Mississippi, Tennessee, Arkansas, then you end up with serious health disparities in those states.
What happens, Gary, is that providers stop taking Medicaid. They say, I'm out, because
they do.
And it's not just the physicians, but it may be nonprofit associations that use Medicaid to hire people or to train people. I'm working with in my current work doing apprenticeship we are working with some nonprofits, and one of their big issues is they don't have enough funding because they're relying on Medicaid reimbursements that are just inadequate to get them
Yeah,
there.
they are. And again, if you feel like your insurance is inadequate, even if you have Medicaid, but you're afraid that you're going to get half the bill, you're not likely to go in for anything, and then you're too sick, right? And then you end up. So economics becomes a barrier to entry. So one of the things that I want to kind of noodle on a little bit that I love to think about, Roger. So we had the Obama era. Obamacare came into being and it became implemented and integrated with some resistance, obviously, from Republicans, and then or with the Tea Party, whoever you want to call out. Trump comes into office. They spend 2 years trying to dismantle Obamacare. It was Cheney actually who went thumbs down, right? But what's interesting is despite what's happening politically, society at the social level, like in Utah and Idaho, voted to expand Medicaid, even though our politicians weren't doing it to begin with, right? They resisted the expansion of Medicaid as part of Obamacare. So it makes me think about the power of social change. And I've heard some people that I have worked with say to me before, never underestimate the power of social change. And so sometimes I think, regardless of what might be happening at this political stratosphere that is not healthy and crazy, is it true that there will be a social uprising that will say, no, we're not, we're going to take care of people. What do you think about that?
I'm not optimistic in the short term. I think that here's what I think. So Biden came in and his solution is some version of the public option, which is really, there's no real definition for what that means, but basically you could choose between a version of Medicare or private insurance, and there would be some subsidies available and that kind of thing. But the point, I guess, is I think the idea that there's going to be this sudden uprising and we're going to suddenly come to our senses and get there all at once is unlikely to happen. I think we have to take these incremental steps, and Obamacare was an incremental step. And some people read it, and I mean, my sense from when you read it was you were sort of relieved that it wasn't as bad as you feared it might be. I was disappointed. It was disappointing that it didn't go far enough, and that my view of Obama's 2 terms in general was he didn't do enough as much as he probably could have and should have. It wasn't bold enough. And so it takes bold leadership, and it takes, and it's going to take incremental change. And even if it's 2 steps forward, as Obamacare was, and then 1 step back, we're still farther ahead than we were before the ACA. And holy cow, it's been 10 years now, 11 years since it was passed. And it's been degraded some. But, that's kind of how we do it. But I don't see, I'm to a certain degree, I'm an old cynic, and because I've just kind of been watching this for a long time, I don't see this this happening in sort of one moment where everybody sort of comes together, or there's a swelling up of sentiment. I think it's going to have to be incremental, but I think we have to take the opportunities when they're there. And right now, we probably have another short window.
Yeah, well, and we can see that, and we'll dive into this in a minute, but we can see how there hasn't been an upswelling of we care about healthcare during the pandemic. We're experiencing that right now. So one of our friends, Michelle, asks or states some of my best healthcare providers don't accept insurance. I think that's also interesting. Consumerism is somewhat of a phenomenon in the United States compared to other countries, where there's some expectation around consumerism. I almost would prefer to go to a physician who I can just pay cash. And I'm seeing that more and more where providers are using telehealth, which makes care less expensive. So they're just charging a $50 fee or something that's affordable. We're going to be seeing this more and more from Google and Amazon providing healthcare. Um, obviously the challenge with that, I think there's absolutely a place for that, but here's the big issue, is that whenever we think about consumerism, again, which I know is there, and we can't like pretend that that's not going to be an influencer here. But what I think happens, that we really forget about from in terms of society, is that when you have a we're dealing with human beings, right? And we have this ability to take care of them. We have healthcare choices, and as our family members and our loved ones age, and they're getting into their 60s and 70s and 80s and 90s, we will see more and more of a expanded lifespan. And so when when you have that population, that's getting sick, and they can't afford to take care of, some significant issues, whether it's diabetes or something else, then we end up with a societal problem in our hands, right? So like I've seen a few people that, well, not, I mean, a lot of people in my community who will say, I'm a rugged individualist, you can't make me get a vaccine. So it's true. I mean, we're not making them get a vaccine, but they end up in the hospital when they get COVID at 35. They end up in our ICU, and they're self-employed, and they don't have insurance, and they don't have a way to pay for the 30 days they're on a ventilator and all the medications that we've used to keep them alive. But I can guarantee you the mother or father of that family, and the children that are not in the ICU, want us to do everything we can to keep that person alive, and we do. And so there's the societal piece that, we have people want to be rugged individualists, and yet they don't want to have a shared accountability with each other. Um, and that's why this becomes such an issue, because in those cases, it is so expensive and difficult to take care of those patients that they have not planned to pay for.
People want to be rugged until they don't. When the crisis hits, suddenly,
Yeah,
please help me. But so long as it's other people, and I think it's somewhat not uniquely American, but more American than it is true. And it goes back to, you can go back and try to figure out the societal causes of this, and where it comes from. I don't have the answers to that, but it's clearly true that there is this sense, and this whole thing about getting a vaccine or wearing a mask is some kind of statement of rugged individualism is
right.
just, I mean, it's almost, for me, inexplicable. But here's I'm going to summarize conversations I've had with other people, because they will say to me about healthcare, well, we don't let people die in the streets. No, we let them die quietly behind closed doors. We
Yeah,
wait.
I don't. Yeah,
No, we drag them off the street and, into a place where we can't see it. But that doesn't mean it's not happening. But it takes, we have to be, we have to be really thoughtful about it, and we have to go beyond what's obvious to us, to understanding the deeper issues. And when someone who is stage 4 cancer finally gets to the emergency room, are we letting them die in the street? No. but are we letting them die? And are we giving them the care in its most expensive option?
Right.
So the humanity aside, that is fundamentally why we spend 18% of our GDP on healthcare, which is in some cases more than double our friends in other countries. So, but it's complicated. It turns out it turns out it's complicated. It's,
Yeah, it's complicated. But what's interesting, and again, this goes back to our media literacy show. I think about my own experience with Obamacare when Barack Obama was first trying to bring that forward, and what's his name? Boehner was the Speaker of the House at the time on the Republican
Boehner.
side, and Boehner trying to like negotiate this deal with Obama, and I know that I had some media illiteracy when I look back on it, because as I learned more about Obamacare and actually experienced it and knew behind the scenes what we were trying to do, we were actually trying to make a difference in controlling cost and improving access, right? Everybody wants to improve access, but no one wants to improve, costs. So when I hear about death panels and Sarah Palin's worried about death panels, well, so what that's basically saying is we as Americans, we think we should have complete access. You should take care of me when I need to be in the ICU, but I don't want you to hold me accountable to cost. And if we want to control costs, we want to improve outcomes, and we want to ensure access, which everybody thinks they deserve, then we need to have some of those options. I kind of have a fun comment here. I see from from James. Thank you.
You're not going to say it out loud, are you?
I'll let you. Well, I think I
Nope.
did. I think I did.
Yeah, you did. But so here's another, I think, relevant point, which is the leading cause of private bankruptcy in our country is healthcare cost, is catastrophic healthcare expenses. I mean, if that doesn't make you really horrified, then I don't know what else to say about the fact that someone gets sick is bad enough. The fact that then they go bankrupt trying to pay for it. And then when they do go bankrupt, we all pick up that tab when there are and it's not as if we don't have a clue what options might be available to us. They're all around us. So let's pick one and try pieces of it, and let's get on with it. And I think you're right that as my generation gets older and we start accessing healthcare more and more on your dime, maybe that will be the moment when there's an uprising. Maybe that, I don't know, but maybe that's the crisis that will create us to look at create the opportunity for us to look at it differently. I don't know.
So James, we have a comment. Thank you. How much does 30 days on a ventilator in the ICU cost? And I wish I could give you that number off the top of my head, but it's when I think about all the costs associated with the ventilator, the nursing care, and the ICU stay, it could be easily $10,000 a day. So you're going to get up to $500,000 in a case like that. And again, I'm getting a little frustrated with what I'm seeing in social media here in St. George, because there is this rugged individualism. There is just, I mean, if I talk about a vaccine one more time, they're going to they call me a socialist, a communist, and yet, I know those people, and I know how their insurance works, and they're going to end up in the ICU, some of them, and they're not going to know how to pay for it. And then that cost does pass on to the rest of us, right? Because we do take care of them. we don't say to people who chose not to make healthcare choices, we don't say to people who choose not to be accountable for their healthcare, you can't come to the hospital.
Sorry,
They come.
you're going to die now, but no, the doors are locked
Yeah.
to you. We don't do that. We don't do that.
Yeah. I mean, what would our people do? I mean, I'm probably going to get in trouble for saying this, but if we put a sign out that said, if you didn't get the vaccine, we can't admit you to the ICU.
If we were truly rugged individualists,
Right.
then we would accept the consequences of our action or inaction, which we don't do. One other thing I just want to briefly touch on, which is this matter of anecdotal evidence, which is true in media literacy, which is true in everything. So I had a checkup with my physician on Monday, and he and I are not we don't agree politically on anything, but we have a great time. He always sits down with me and we have a long talk because it's fun, and we can gently disagree with each other. And so I started talking about this issue, and I was talking about Canada, and what I said was, I asked him, what percentage of Canadians, what's the overall approval rating of the Canadian healthcare system among Canadians? It's 90+%. We don't have anything in our country that achieves 90% approval rating. Anything, apple pie, no, not 90%. And so he said, yeah, so there was a friend of mine told me this story about a woman who had cancer and couldn't get in for 6 months and died. Anecdotal evidence.
Right.
That may have happened. I don't know, in the larger picture, as hard as it sounds, that's not dispositive. That really isn't the point. There, you can always find the outlier stories, always, and that's where we tend to go. We go to the outlier stories when we want to defeat, and there's a long history of using that technique, and we've gotten really good at it.
And it's so frustrating because, like in the world of genomic research, for example, if I found a gene mutation in a patient with multiple sclerosis, and I started to come out on YouTube saying this gene mutation causes multiple sclerosis, and I have one example, I would be completely illegitimate and laughed off the stage. In order to make that statement, I would need 500,000 examples of that. And I would need to hear
it gets to causation versus correlation and all those kinds of things that you know far better than I do. But and many people don't understand that including a lot of scientists, though, there are a lot who don't appreciate causation versus correlation, but that's a whole other topic.
Maybe that's another episode.
No, I don't know. I was talking. I would be a disaster.
We have another comment. Michelle, because there are plenty of people in America who can't get the care they need. Oh, maybe I missed it. A privileged white male doctor.
That would be my doctor. That would also be me, and that's a whole other topic that for another time is the whole idea. And believe me, this is a scary thing to say out loud. The whole issue of white male privilege. Oh boy, just toss the grenade because but it's demonstrably a real thing.
Yeah. Some of our viewers, our friends watching, their blood will boil, as we've heard before.
Totally gonna lose it.
So I want to share a story as we kind of talk through, and I'm not sure how much time you have, Roger. So as we kind of wind things up a little bit here, I remember during the Trump fiasco with the Republican Congress and their attempt to get rid of to get rid of Obamacare. And by this time, I had a much better understanding of what we were trying to do. And I actually became part of trying to help that work and help that happen. And my mother, I was being snarky. We went out to dinner, and we were with my kids, and I got a tweet over my phone that that Cheney put a thumbs down on this whole scrap Obamacare, which is a huge defeat to Trump. So the first thing I said to my mom was, "Looks like Trump really screwed the pooch," and I got in big trouble. I'll tell you that. And later we had a discussion about it and why why I was supportive of not getting rid of Obamacare. And I used the example of Medicare because my mom and my dad are on Medicare. And I said, Medicare is paid for, because they wanted to talk about socialized medicine. If Democrats in the word, it means socialized, right? They wanted to talk about socialized medicine. Well, what does that even mean? Well, it means the government's providing the healthcare. And well, the government is providing the money for your healthcare. And my mom said, yeah, but we paid into the Medicare system. And what I want to say about that, as we really try to think about the future. So my mom and dad, yes, they paid out of their paycheck compulsory into the Medicare system. And that calculation for them in the 50s, 60s, 70s, 80s, 90s was based upon a lifespan that assumed they would be dead by now. My mom and dad are in their 70s. Maybe the presumption was 80. And my mom and dad will very likely live into their 90s or beyond. And so we're going to have to figure out how to take care of them. Is the solution to say, well, you just don't get any more Medicare, so at 80, you're going to die? Or do we say, we're going to fund Medicare and we're going to expand Medicare, expanding Medicare to younger ages? So I have a sister-in-law, for example, who is 55, divorced, doesn't have good in health insurance. Her employment is sketchy, and she gets breast cancer. Well, she should get Medicare too, because Medicaid is so difficult for her to get, right? So part of when we start talking about society and helping each other, and it's not just about society, and we're going to be good neighbors. It really is about civic duty and civic responsibility, and recognizing that there are institutions that we can leverage, including government programs that can help to distribute things like Medicare, and ensure that doesn't get lost in the shuffle, or lost in some private organization. And so what I hope to see happen is expansion of Medicare for the older, and really drop that age, and as a baby step, right, Roger? And then an expansion for sure, more for Medicaid. And what I'd like to see with Medicaid and states doing, which they'll get a return on their investment if they will invest in things like preventative care, education, mental health. Mental health is a big issue, and figuring out how to provide social services much earlier in someone's life than when they are suicidal, but much earlier in terms of intervention. What do you think about that, or do you have any comments about?
I can't say it any better other than to provide some other examples of the same idea, which is,
Yeah,
instead of incarcerating people, getting them treatment for drug abuse. It go beyond the fact that it's the right thing to do as a civil society. It's less expensive. We incarcerate more people per capita than any other country in the world, and it's not a good investment, pure and simple. The idea, when you talk to people about Social Security, well, I paid into that. Same problem. the actuarial tables when it was created were where you were going to die at 62. So yeah, you're going to pay into it. And you're going to get a couple of
Yeah.
years. And
Yeah.
now those people are and I'm hoping I'm one of them, will be, uh, getting paid Social Security benefits for 30 years. That was
Yeah.
not part of the deal. And so you didn't pay for that. You're not, you just didn't. And it's just important for us. I'm not, and it's not about making people feel bad or, or pointing the finger or whatever. It's about being honest about how this all works and helping people understand that it's not magic, that you're all you're getting is what you paid into it and you're getting that back. No, you're getting a benefit far beyond what you paid in. And that's true of Medicare, and that's true of Social Security. And we need to start thinking about these things in a more sophisticated, bigger picture way.
It's interesting because that actuarial table you're talking about, number one, it didn't contemplate people living much longer. It also didn't contemplate improved technology. So as the technology increases and we can do interventions we never could do in the past, that also increases, in terms of expense that those tables that you mentioned did not take into consideration. And again, what I know will happen, because I experience it all the time, people will complain about the cost of healthcare. They'll say, well, make drugs cheaper. So they want to go after the drug company or whatever. But the truth is, there's a demand out there for better healthcare in terms of technology. So we do innovation, we do clinical trials, we develop drugs that can teach your immune system to correct or to eliminate the mutation that's causing your cancer. That's Star Trekky in terms of technology. That's expensive, but I guarantee you, there's an expectation that you get that if you have a family member, or that your family member gets that treatment when they actually get sick. Even though you're complaining about the cost of healthcare, you still demand it, or at least your family members are going to demand it when your butt's in the ICU.
The irony here, that isn't lost on me, is that you and I are members of the white privileged male class.
Mm-hmm.
And so it's a little it's a little ironic that we're talking about this stuff, because we are the beneficiaries of our culture more than any other segment of any other
Yeah.
society in the history of the world. You and I. But I think that also puts upon us a certain responsibility to be thinking about these things. This is why I think what you're doing is so important and so great, is that I do think that there is a need for us to be talking about this. And I get that in the whole lottery of when and where and how you're born, I hit the jackpot.
Mm-hmm.
But so maybe that requires a little perspective on how we approach these problems.
I agree, and I realize that about this show. We are in a demographic that has benefited, and I recognize that. I still have more to go in learning about that. I hope that I can be, and we can be advocates, that we can be allies, to help make a shift in social change and to support the social change in a way that actually accomplishes what every one of us want. Everybody that is watching, from the spectrum of the political spectrum or religious spectrum, I know at the end of the day, we all want the same thing. We want our families taken care of. We want our families safe. We want our families getting the best care and treatment. And what I would offer is that to move our mindset into the 21st century, we keep, I see these political candidates and what's happening, online, and we hearken back to a time when Cleon Skousen wrote a book, back in the, decades and decades ago, or, or even the Constitution itself, right? Not that it's not an important document, but it is the 21st century, friends. And with it being the 21st century, we have vastly better concepts of economics. We have much better understanding of monetary policy, how to leverage government. We have much better understanding of relating to healthcare. And so all of these factors, I want to see us logically and with data put them into play, because we are only going to find ourselves in the future. We're not going to find ourselves in 1950. We're going to find ourselves in 2030. And what's happening is wealth is generated more than ever before. Billionaires are created now more than ever before in history. And we can, I suggest, come together as a society to take all of these resources and help figure out ways to relieve human suffering and create a better life for our fellow man. There's, I would suggest, plenty of money to do it.
More than enough. And I'm gonna do an inside joke here. So referring to Skousen, I presume you're not talking about the first 2,000 years, which was also a Skousen book, but something different.
5,000 year leap or whatever.
Yeah. So you're right, and that's the point. And I couldn't say it better. And it's a great way to finish the conversation. But I think that's the thing is, this is not an either or circumstance where we don't have to give up our rights to provide a better life for other people. We don't. It's not that kind of a choice, and so we just need to get on with it.
And utilizing government infrastructure and public policy is one of the levers we have at our disposal to pull.
Yeah, you're a commie,
right? I know, but I'm just talking like, well, this is my whole point. Like, this communist scare, McCarthyism, don't be a communist. We're scared of communists and socialists. It's seriously, it's an old narrative from a time that doesn't exist anymore. Communism, in the way that we were scared of it in the 50s, doesn't even exist today. The Chinese, yeah, go ahead.
The whole ridiculous fear of communism is what got us, and the domino theory is what got us into Vietnam. We didn't learn from that, really.
Right. So again, like, one of my episodes, a guest that I had said something I thought was very wise, that there's a hypothesis that some of human suffering is caused by our inability to accept reality that is around us. And my challenge to our audience is to lean into reality. And that reality includes the fact that it is 2021 going into 2022. We live in a massive society that is very, very well connected through travel, which will even be more so. I mean, if we see space take off the way that we think it is, people will be able to travel from Paris to New York in an hour. So we're interacting more, which obviously has an impact on society, like in the pandemic. And if we want these luxuries, if we want to participate in a rapidly evolving world where technology is making our lives better, then there's a civic duty we have to each other, so that we can enjoy those things. And so let's reframe and let's really discover what the future has to hold for us.
So I'll leave you with this. Right on my wall here that I'm looking at, right below my diploma from Gonzaga, is a cartoon, and it says, "I tried reality, but it didn't work for me." That's what's going on here. Is reality doesn't work for a lot of people, and that's our problem.
Yeah, and let's lean into that reality, and if we care about each other, we'll fix those inequities.
Agreed.
So thank you, Roger, for another awesome episode. I do want to ask you before we go, I have had a friend watching that would like me to talk about criminal justice. You brought up criminal justice, and I don't know if that's something you feel like you could talk about in a future episode.
That's above my pay grade, Gary. I mean, I'm trying to stay with things that I've spent some time with, and I don't know enough about it to be to do it. So you'll find there are better people than I for that one.
Well, for those that are watching, or you, Roger, if there is someone that I could talk to about the criminal justice system, um, contact me or comment below.
By the way, if you want to read a great book that touches on criminal justice, the book Noise is
Okay.
is a fantastic book, and it talks about the inequities in criminal justice, among other things. Just a pitch for a good book.
Okay. Well, thank you everybody for joining us tonight on another episode of Topic Discuss. We'll see you. Peace out.